All about teamwork. As the owner of a radio station, he relies on a group of professional colleagues to keep him on the air.
Hey, Don Guadalupe!
And he relies on a team of healthcare professionals to help him manage his diabetes.
Go see the doctor even if you don't feel anything. And don't forget it when you got it. Don't forget it still with you.
Take a cue from Lupe and think of the healthcare professionals you'll be seeing as your team. And remember, they're all on your side. Ask how often you should be coming in to see your doctor and set up a schedule for regular checkups. Your team might include a specialist called an endocrinologist.
We are specialists in the glands of the body that make hormones. Now, the pancreas is a gland that makes hormones, and insulin is a hormone, so endocrinologists are experts in diabetes.
Whether you see a specialist, visit a clinic, or see a family physician, your healthcare team will help you develop an overall plan for managing your diabetes. For many people with diabetes, that plan will include medication. For many people with diabetes, medication can be very helpful in controlling blood sugar.
We have many different combinations of medications to use for our patients. And of course, that allows us to help most of our patients meet their treatment goals.
Tom has type 1 diabetes, which means his body does not make insulin at all. So he needs regular doses of insulin to control his blood sugar. Like many people with diabetes, he was at first concerned about handling the insulin injections himself.
Oh, I was scared to death. It was, first of all, didn't like needles. I'm like, I gotta do this the rest of my life. And the first thing that came to my mind was, can't.
But he could, and soon he realized how much better the treatments made him feel.
The trade-off between checking your blood, giving your insulin, is well worth it for feeling good every day.
While everyone with type 1 diabetes needs to take insulin, it can also become part of the treatment plan for people with type 2 diabetes.
Insulin is the most powerful of all the treatment choices that we have for diabetes. So we're using it earlier. We're putting it to better use with our patients.
One of the reasons insulin is being used earlier for type 2 diabetes patients than it used to be is that there are many more ways to take it.
The technology from 10 years ago to now has come such a long ways. It makes it a lot easier to treat.
Needle injections, insulin pens, and pumps have been available for many years. Recently, a new option was approved, a powdered form of insulin that can be inhaled. A discussion with a doctor can determine the form of insulin that's best for each individual. This is also the time to discuss any concerns you might have, such as the stories Lupe heard about insulin when he was growing up in Mexico. He found out his doctor had heard those stories too.
Back there, there's a belief that once someone starts taking insulin, it's not going to be too much longer before they die. But the important thing for patients to understand is it is not the insulin that caused the problem. It's actually quite the opposite. When insulin is used early on and you can lower those blood sugars, you can actually prevent complications.
Whatever medication is prescribed and however you take it, it's vitally important to take it as directed.
Diabetes can be a very asymptomatic disease. That means you don't feel anything and your blood sugar's out of control. So it's critically important to take one's medication, and for that matter to continue testing, even if you feel perfect.
Like many people with diabetes, Diane was concerned about the impact it would have on her busy life. In addition to taking care of the horses and commuting to her job, she loves to travel. She wasn't going to let diabetes get in her way.
We recently returned from Australia and New Zealand, and the flight attendants were helpful. They would bring me ice so that my insulin would stay cool.
As someone who's been managing diabetes for many years, Diane has found ways to fit it into her lifestyle. In fact, lifestyle, what you do, what you eat and drink, can have a major effect on controlling diabetes. Carol takes her medication every day, But she knows you cannot depend on medication alone to control diabetes. This is a disease that can affect your whole body and your whole life, so it's worth putting your whole self into the effort to get healthy.
Remember, you're not on the sidelines with this disease. You need to get in control of it. And the way of being in control of it is getting the information that you need about it, educate yourself.
The concept that there are bad foods and good foods doesn't really hold, but here's what everybody with diabetes needs to know. Every time that food does go past your lips, that's going to do something to your blood sugars, and you really need to know what effect that food's going to have on your blood sugar.
The basics of good nutrition are important for everyone. For people
And that keeps me from digging that big soup spoon into the half-gallon of ice cream. Very often, I'll stop by a restaurant, check out the menu, because I don't want to be embarrassed when I get to a restaurant and, be unsure about what's in the food or what I'm going to order. I feel better if I know in advance, especially if I'm out with a large group of people. Whatever you're ordering, just ask them to put the sauce on the side. That way you can get some of the flavor from the sauce, but you don't have to be swimming in it. And of course, that's good with salads too. So little changes can have a big effect.
When Lupe learned he had diabetes, he worried he could no longer enjoy the Mexican food he loves. But working with a diabetes educator, he learned he can still have his favorite foods. He just has to be more careful about how they're prepared and about how much he eats.
There's many cultures that we deal with here and many varieties of foods, and no, they don't have to give them up. What we have them do is do a food diary or food log for a few days or a week. We see what's on there and we help them make choices on putting them together, but incorporating the foods they enjoy.
Okay.
Tom has some expert help right at home. His wife, Shar, is a nurse.
My wife is my watchdog. Besides being my best friend, she's a partner in this.
Together, they shop for foods that are good for managing his diabetes. But of course, the choices are good for Shar's health as well.
We prepare our own meals, eat a lot of salads, lean cuts of meat, fruit. That doesn't mean I don't have a piece of cake or anything like that though either, but you just got to make decisions that not only diabetics should be making, but everyone.
While we're talking about what you eat, it's important to remember that what you drink is part of the picture as well. So many thirst quenchers are full of sugar. Be aware of what's in your glass. And as for alcohol, talk to your doctor first.
Alcohol directly affects the blood sugar concentration. So if one's careful and testing blood sugar regularly and taking food with alcohol and monitoring very carefully, and of course in moderation, then many physicians do allow people with diabetes to have a modest amount of alcohol.
You can get exercise almost anywhere. Lupe is always ready to dance.
You don't think about diabetes, you don't think about insulin, you step and have fun.
Exercise and keeping fit actually improves the muscle's ability to take in glucose from the blood and then to process that glucose. If you have type 2 diabetes, it might be all you need along with the diet because the sugar now gets into the muscle cells better. And if you have type 1 diabetes, even though you still need to take insulin, it allows that insulin to work better.
Exercise not only helps you manage your diabetes and control your weight, it also just feels great. On the weekend, Diane enjoys playing a round of golf, but she keeps moving during the week as well.
I walk with a coworker and we try to go, it's basically 2 miles that we try to do at lunchtime. And even some of the cold, rainy days, we did try to get out there and walk.
Tom spends his work days sitting at a desk, so he and Shar try to add exercise into each day, either outdoors or inside.
And it's not necessarily